Hi guys, welcome to my channel Medico Ankit. Today I am going to demonstrate clavicle. It is one of the bones of the superior extremity, and clavicle is also called collarbone, or it is also called beauty bone. What type of bone is clavicle? So clavicle is a modified long bone. And why it is called modified long bone? Because it is the only long bone that lies horizontally, and it has two primary center of the ossification, and it ossifies in the membrane, and it is the first bone to start ossification and last one to complete ossification. So these were some reasons behind its peculiarity. Now I am going to say the anatomical points of the clavicle. This is the clavicle of the left side. Enlarged rounded external end lies medially, flat acromial end lies laterally, and shaft is convex in its medial 2/3 and concave forward in its lateral 1/3. Now middle third of the shaft contains subclavian groove on the inferior surface. Now what are the parts of the clavicle? This one is the external end, and this is the acromial end, and this is medial 2/3 of the clavicle, and this is lateral 1/3 of the clavicle. Medial 2/3 is convex forward and lateral 1/3 is concave forward. So in this way we can identify the medial 2/3 and lateral 1/3 of the clavicle. So medial 2/3 has no borders. It has four surfaces: anterior surface, superior surface, posterior surface, and inferior surface. And lateral 1/3 has anterior and posterior borders and two surfaces: superior surface and inferior surface. Now what are the muscle attachments on the clavicle? Pectoralis major originates from the anterior surface of the medial 2/3, and superior surface has sternocleidomastoid muscle, and posterior surface has sternohyoid muscle. Now I am going to the lateral 1/3 of the clavicle. So lateral 1/3 has anterior and posterior borders. Anterior border has deltoid muscle and posterior border has trapezius muscle. Now there are some ligaments on the clavicle. In the external end there is sternoclavicular ligament, and in the acromial end there is acromioclavicular ligament. And middle third of the clavicle has subclavian groove. So here and there is subclavius muscle. In the lateral 1/3 near the posterior border there is a tubercle. It is called the conoid tubercle, and there is also a line near to the conoid tubercle. It is called trapezoid line. So what are the attachments on this conoid tubercle and trapezoid line? Conoid tubercle contains conoid part of coracoclavicular ligament, and trapezoid line contains trapezoid part of the coracoclavicular ligaments. Now posterior surface of the medial 2/3 has a relation, that is trunk of the brachial plexus and third part of the subclavian artery related to the posterior surface of the medial 2/3 of the clavicle. Now I am going to say the joints and articulations of the clavicle. External end articulates with the clavicular notch of the sternum, and it forms the sternoclavicular joint, that is saddle type of the synovial joint. The acromial end forms acromioclavicular joint with the acromial process of the scapula, and it is plain type of synovial joint. Now I am going to say about the clinical anatomy related to the clavicle. Clavicle is mostly fractured at the junction of the medial 2/3 and lateral 1/3 of the shaft. That's it for today. Thank you guys for watching my video.